Hi, it's Elizabeth, and today we're talking about chronic constipation. Up to 1/3 of the general population has reported having constipation at one point in their lifetime. And so that's a large number. And what we want to kind of talk about are some of the different types of constipation that you may have experienced or you are experiencing. One of them is called slow transit constipation. This is when it takes a while for the stool to go through the colon and into the rectum in order to be evacuated. The other one is dealing with the mechanics of defecation. So this is the coordinated movements of your pelvic floor muscles and the anal sphincters in order to be able to push at the right times. So we've talked about kind of how to do a Kegel contraction, and with proper defecation, the muscle should be doing like a down and out push, opposite of what that Kegel contraction should feel like. We've discussed some of that in some of our other videos and articles, if you want to go back and refer to those. But what some of the symptoms, if this is going on, what you might find is that you are straining when you sit down to have a bowel movement. Your stool comes out kind of hard and thin, or possibly even kind of like pebble-like shapes. And then treatment-wise, if you're using the Kaheel, you want to go into the manual mode and look and see if you're doing that full relaxation. And again, we've talked about that in a different video. So you can go back and see if you do a contraction, when you go to relax, if that line is coming all the way down, and that would be your full relaxation. And so you would work with that to make sure that you're getting that full relaxation. If you're there and you're still having trouble having your bowel movements, it would be a good idea to try to find a pelvic therapist so that they can do further assessments with you and see what is happening as you are trying to do that bulging and relaxation of the pelvic floor. They can also talk to you about diet and nutrition and how helpful those can be, as well as possible modifications to how you're sitting on the toilet and different breathing techniques, so that you are not holding your breath or straining as you are trying to have a bowel movement. And hope that's helpful.